Welcome back, everybody. This Week in America on the Blue Funk Broadcasting Radio Network. Great to have you with us on the program today. And reminding you that you can follow and like us on Facebook. Very simple, facebook.com/This Week in America. Facebook.com/This Week in America. An important program today, as mentioned, our guest is Dr. James Marcum. He's a board-certified behavioral cardiologist with a thriving practice at the prestigious Chattanooga Heart Institute. A sought-after speaker, a best-selling author. We're talking about one of his newest books, Medicines That Kill, The Truth About the Hidden Epidemic. Dr. Marcum, welcome to the program. So much to talk about. Thank you for being on the program today.
Yeah, I appreciate it, and I think this is an important book, especially for our society. They need to know about medications, their risk, its limitations, and where we're at in this year about how we should approach medicine. And with all this Affordable Care Act, people are thinking a lot about their health, and what a great place to start talking about is medicines.
Well, Medicines That Kill, The Truth About the Hidden Epidemic, and you start off the book by quoting one of the founders of Johns Hopkins Hospital. The person who is undertaking medicine, who takes medicine, must recover twice, once from the disease and once from the medicine. Now, most people would think if I'm getting medication from my doctor, this really is okay. He's listened to me, I've told him everything, and this is actually going to work positively for me. And you can make the argument that problems with drug is the hidden epidemic and maybe the leading cause of death in the country.
Yeah, and that's actually why I wrote the book, Rick, is, through the years, I've been practicing cardiologist for over 22 years, and I see patients every day. And, and over the last 2 decades, we look, the rate of heart attacks keep going up. The rate of cancer keeps going up. Sleep apnea, diabetes, mental health problems, all of these problems are worsening. The death rates aren't dropping, and that's despite the best technology in the world and 4 billion prescription medicines written every year. So as I look back at this, I started digging through the statistics, and they're not easy to get because there's such political lobbyists out there, big pharma, big insurance agencies, the government. These are big entities, and they don't want this information to get known. But as I dug through it, I started adding up the limited statistics I got, and I found out, and I think the book would support it, and I lay out a good argument. The readers can look at the facts myself, that the number one cause of death in America is not heart disease, it's not cancer, it's actually medications. Now, I'm not one that says there's no place for medications because I really believe that there is a place for medications, but it's not what we've created. We have the American Heart Association, we have the American Cancer Society. Well, I want to bring an awareness to our society. It's now time for the American Society for the appropriate use and responsible use of medications.
You're listening to This Week in America. Our guest on the program is Dr. James Marcum. The website is heartwiseministry.org. Great information there, a great opportunity to buy the book and to get a lot of life-saving information. The name of the book is Medicines That Kill, The Truth About the Hidden Epidemic. It's interesting in the book, and this is sort of an eye-opener to most of us who go to the doctor expecting medication and expecting that medication to work and for us to feel good. You talk about in pharmacology class in medical school, the instructor gets up and says, okay, now I'm going to tell you about poison. And you make the case there, and I guess we never really thought about that. When we're looking at medicine, we're basically looking at what? Poison.
Yeah, our bodies were not made to ingest foreign substances. And each foreign substances that we put in ourselves hopefully it has a benefit, but it also has a risk. And medicines were originally invented just to last a short period of time. They were never intended to take year in and year out and year in. But our society has gone to mainly treating symptoms and not getting at causes. So we have to realize that when we take these medicines, there's always a risk and a benefit, and also there's interactions when we start taking one and another, and it also affects the way we hydrate ourselves, the way we drink. Metabolism affects the way these medications are used, and throughout the book I show all the pitfalls and all the stumbling blocks and all the assumptions that are made about medications. We assume that all the medications are correct. We assume that they're correct in the pill that they're in. We assume the dosages are correct. We assume that the doctor has done the research on them or the pharmaceuticals, but that's not the case. As I've gone through the years, one of the first medicines I heard about when I was coming up was a medicine called Fen-Phen, and everyone was on that. It was a great weight loss medicine until I found out a little while later that it was destroying heart valves and killing people. Then another one, a cholesterol medicine, Baycol, the best ever. Then they found out it was killing people from liver disease and myositis. That was off the market. So in the book, I looked at all the medicines that have been off, and recent ones like Vioxx off the market. You know, some of these diabetic medicines now have been pulled off the market. Well, medicines not only have risks, but the benefit margin might not be as large as the advertisements indicate.
And all those that you mentioned that are now off the market, in the case of fen-phen, you've got a chapter in there where you're talking about that with a patient who unfortunately lost her life, but she was all excited about taking it because she was losing weight. All of these went through the process, years, billions of dollars. They're approved, and we all think as consumers, and I'm sure you think as a medical doctor writing the prescription, this is going to work for my patient. And then years later, you find out, no, it has detrimental effects and actually can kill.
Yeah, and that's the scary thing. You know, a lot of medicines are coming off the market quicker than ever. And I saw an advertisement for medicine on TV the other day, and it gave, about 10 seconds about what the medicine did, and the next 20 seconds telling you all the bad things it could do.
Yes.
What I've moved to, Rick, in patients, I tell them the risk and benefits, but if there's any way they can change their chemistry naturally and not take the risk of a medicine, I really try to help them. And the book gives some really good recommendations regarding that, and talking to doctors. Is there any way I can be off this medication? And if you're on a medication, it behooves you to know everything that you need to know about it. How should I be taking it? Does it interact with other medications? What are some danger signs that I should be looking for if this medicine is not working appropriately? And a lot of people in our streamlined medical system, the doctors, bless their hearts, they're not having the time to educate as they should, and sometimes the patient goes to the website or the drug insert and they're just overwhelmed by information. There's got to be some simpler ways to let people know about the most common problems with drugs and ways that they can be a good consumer, and I try to help them through that in the book.
The book is Medicines That Kill, The Truth About the Hidden Epidemic. Dr. James Marcum, our guest on the program. HeartWiseMinistry.org is his website. You can link onto that at our website, thisweekinamerica.us. And you talk about that when you get out of medical school, you're ready to start practicing, you're idealistic, you're ready to go, and then suddenly reality hits you. You literally have people lined up outside the doctor's office, the front door, ready to come in, and you don't have the time to really spend and educate. How frustrating is that, sort of the economics of the way medicine is dispensed now, where you really maybe have to rush a little more than you would like to and not have the time to actually sit with somebody and explain things?
Yeah, it's terrible, and that's the most important. Why I went to medicine was not only it was so interesting, but the healing, the relationships. Those are the reasons you go into it. When I first started, Rick, I spent probably 75% of my time directly with patients and maybe 25% with paperwork. As little as 5 years ago, I sort of figured out what I was doing. It's about 50-50. 50% of my time paperwork, 50% with patients. Just this last weekend, I calculated, and now it's down to about 25% of my time directly with the patient, 75% with all the paperwork, the computer terminals, filling out the forms, the files, and all the things. And as we pulled away from that relationship, the communications has dropped off. And that's hurt medicine, and we're all talking about the Affordable Care Act and these type of issues, and those are all important. I want everyone to have great health care, but we're not addressing the real problem. And the real problem is our system treats symptoms, and we don't get at disease causes. But to get at disease causes is not a moneymaker. It's an educational thing. It takes time for the doctors to interact with the patients, teach them, have follow-up, work with them, develop relationships so people can keep making these changes. And as long as our system does not do that, we're going to continue to spend more money. We're going to see disease rates rises. We're going to see lots of frustrations with doctors as well as the patients because we're just not getting at the cause. And the media, bless their hearts, they're so good at selling things and making money, but we need to sort of step back for a second and say, 250 years ago, if I didn't put leeches on a patient, I was considered a bad doctor. George Washington had half of his blood drained out before he died. In the 30s, in the American Journal of the Medical Association, if you didn't put cigarettes, if you didn't give cigarettes to people for asthma, you were considered a bad doctor. And just a few, not too long ago, they were giving cocaine for people with toothaches. I just wonder when they look back at this period of time and how medicine and healing's practiced, they're going to just look back and say, wow, what were these guys thinking? But I'm hopefully getting a voice out there so that the people can hear this, and they can be their own best doctors, and they can look at the judgment and make decisions on their own. And thank goodness for programs like this and the internet where people can get a different perspective. I'm not saying I'm the only perspective, but I want to get this out there and let people look at the evidence and decide for themselves.
You mentioned the media and advertising, and I remember about a month or so ago reading a feature story, front page in the New York Times, talking about selling that new man feeling, talking about low T. And we see this advertising literally all over the place, and it's very, very well done. Now I'm hearing there are a lot of negatives to this, and everybody's going, whoa, let's sort of slow down here. What is the impact of television advertising, and do you get people that actually come in and say, Doc, I've sort of self-diagnosed myself? I probably don't say it in those words, but I know what I need, I know what I want, and then give you the name for the medication?
Yeah, every day people come in, they've seen an advertisement, and it might not be just for medicine. Sometimes it's for a supplement, a new procedure, or whatever's out there, and the advertising is so good and so convincing, and the patients come to you and they say, I want this because of this, and here's my demand, sort of like.
Right.
And I have to say, well, luckily for me, I've got, I can be honest with them and say, listen, I love you enough to tell you the truth. This might not be the best for you. There might be a better way. And if I really feel strongly that it shouldn't be done, I say, listen, this goes against who I am. I have to sleep good at night. I suggest you might find someone else to help you with this problem. But it is a problem. The media is out there, and if you look at the amount of time people are spending with the media, it's enormous. And I'm recently doing some research about how the media actually damages our body, damages our brain, our relationships. It's just very fascinating. But when people are spending 6, 7, 8 hours a day on media, the media really controlling the way people think, and they hear all these sound bites, and they sound convincing. And believe me, people are experts. One great example is the cigarette industry. We're coming 50 years from the anniversary in 1964 when they said, cigarettes can kill you. And at that time, about 46 or 7% of people smoked cigarettes. It's down to 18% now. But over the years, it improved a little bit here, but the industry took it out to the world, and now 1 billion people are smoking cigarettes. 1 in 3 adults are smoking cigarettes now, so they just gone and found a better way to do it. And, it's their jobs to do these jobs, and they're doing it well, but the other side, the other voice doesn't have all that money and all the power and all the media exposure that it needs to. But thank goodness for the internet and other ways that people that really want to learn some things can get in there and get some different viewpoints.
The book is excellent. It's called Medicines That Kill: The Truth About the Hidden Epidemic. Dr. James Marcum, our guest on the program. His website and a wealth of information there, and an opportunity to purchase the book is heartwiseministries.org. We're talking about the negative impact of prescription medicine and mixing it with over-the-counter. All that's in the book, and a lot of positive in the book as well. You talk a lot about transcendent power, where you realize there's something sort of very basic, back to biblical principles that really will help us if we will open our eyes, mind, and listen.
Yeah, Rick, and that's what, I'd like to at least open people up to look at their spirituality. Me personally, I believe that there's a higher power that has designed us to work in certain ways, our chemistry is designed to, for instance, we're designed to rest, we're designed to drink water, we're designed to have sunshine on us, we're designed to serve. And when we go against the way we're designed, we have these negative chemical reactions that occur, this stress response. And if it goes on long enough, there's symptoms, and then there's symptoms lead to diseases, diseases lead to medications. And these are all things that I think are part of the healing process, and we just don't talk about it, even though it's strong. The literature is strong about these things. These things are out there. We can prove it. Dr. Andrew Newberg at the University of Pennsylvania has done some cutting-edge works on how your spirituality affects your health. And I added this in the book because I didn't want the book just to be negative. I wanted to give people hope, to give them some things that they can do to make their life better. This is a book that calls people to empowerment, ways they can do better, make their life better. It brings a new voice to the discussion in medicine and let people know that all doctors don't necessarily think the same. And all of us are healers, Rick. I know you've done a lot of work with St. Jude's for the year. When you work with other people, when you make them happy, when you serve them, you're improving your own chemistry. And we can prove that now chemically, that all these things, we were designed for a purpose, and there's all a sort of a master plan. And I want people to know that that's part of the healing process as well.
The book is Medicines That Kill, The Truth About the Hidden Epidemic. Dr. James Marcum, our guest on the program. HeartWiseMinistries.org. It's an excellent website, a lot of great information there. A couple minutes left in the program. You talk about some of the things you can do to improve your health immediately. And a lot of this does not require spending a lot of money, actually doing a lot of research. It's fairly basic. Let's leave people with some things that they can do to turn their lives around. And as we talked about in the program and you talk about in the book, so often the medical treatments we get really are masking the problem and not really fixing them.
Yeah, they don't. I want to leave people with just 3 things that they can take home with them today, prescriptions that don't have lots of side effects, that are based on our original design. Number 1 is drink enough water. 70% of Americans don't drink enough water. When we don't drink enough water, everything goes haywire. We have joint pains, our blood gets thicker, our blood pressure changes, our medicines aren't metabolized correctly, we don't think as well. Lots of bad things. So I want to encourage people to drink water. Drink till your urine comes out clear, or take your weight, divide it in 2, and that's about how many ounces of water you need a day. Number 2, our bodies were designed to rest. So number 2 prescription is make sure you're getting enough rest. Edison really messed us up when he invented the light bulb. Originally, we were designed to work in the day and rest at night.
Yeah, we had to. We couldn't do anything. It was dark.
That's right. How many people rest at night? We disrupt our circadian rhythms. It puts a stress response on us. I also believe that we are designed to take a day off a week and rest and just let our bodies recover. There's a very powerful treatment in rest. If I broke my arm, I wouldn't keep throwing fastballs, Rick. I'd let it rest and heal. Well, the body was designed to have some semblance of rest. So number 2 prescription is rest. And number 3, get outside. Most people don't get outside very much, and we know that up to 60 to 70% of people can be vitamin D deficient. And vitamin D is a very important pro-hormone that helps us stay away from depression, makes our bones stronger. It influences heart health by changing the way chemicals like renin and angiotensin are regulated in our body. It's just something very important. And in our modern age, most of us are staying indoors and not going outdoors. So 3 prescriptions today I want to leave with very few side effects. Drink enough water. Concentrate on getting more rest, and make sure if you don't get outside 30 minutes 3 times a week that you take a vitamin D supplement, or at least have it checked by your doctor. These are 3 easy things that we can do that really will change your health dramatically.
Got about a minute or so left in the program. I want to end it and go back to the beginning of the book where you're saying you really toiled as you sat to write the introduction. And when you put it in perspective, you're thinking, even though all these patients that I've treated and I've sat with and I've helped through medical problems, this may be, because of the number of people I'm going to reach and the power of the message, this may be the most important thing that I do to try to help people.
Rick, if this message gets to more people and it gets, quote, viral, I think this could have the potential to help more people than anything I've ever done in my life. And I just hope that your listeners will spread this information and get this message out, because, HeartWise is a nonprofit. We don't have a big advertising budget, but we think this message is important.
And you can get all the information at the website, as Dr. Marcum mentioned, which is heartwiseministries.org. Dr. James Marcum has been our guest on the program, author of a number of books. We will have him back on the program because much more to talk about. It really, literally is life-altering advice. The book is Medicines That Kill, The Truth About the Hidden Epidemic. It's available Amazon all across the country and, of course, available at the website. Again, Dr. James Marcum. The website is heartwiseministries.org. If you can't remember that, just go to our website, thisweekinamerica.us, and you can link on. Dr. Marcum, a pleasure to have you on the program. We look forward to having you back on the show.
My pleasure, Rick, and thanks for having me.
You're most welcome. You're listening to This Week in America on the Blue Funk Broadcasting Radio Network.